everyone, my name is Tim Wagon with the Avalon Foundation in Houston. We are back with Megan Moiko, who is the Chief Clinical Officer at Choptank Community Health. Megan, we're back after what for some was a long weekend, and wanted to ask you on this Tuesday, what did you see last week in terms of COVID in Talbot County in the area?
Yeah, thanks, Tim. I would say that we are starting to see a very small shift from, having almost half of all of our tests come back positive to maybe more like a third, which might not seem like it's a big deal, but I will say that I think that is hopefully reassuring that we're going in the right direction. Our school-based providers are packed and incredibly busy seeing kids, so that's a great resource there. And I think the other thing that we're starting to see is just all of these people that have had Omicron in the past few weeks. They are, having some lingering symptoms that we're, trying to work through.
What kind of symptoms are they having? Lingering symptoms that you talk about?
Well, you name it, but the fatigue and the cough, I would say, seem to linger a little bit.
There seems to be an impression that the case rates are lowering in Maryland, and is that happening also here on the Eastern Shore then?
Well, I think we're definitely seeing it as far as the state goes, and it's really nice to see those numbers come down, including hospitalizations across the state. I do wonder how many positive rapid tests at home that people are getting, and they're not being reported and not being counted. So, that is something to consider.
Why is that important, Megan, to report those cases that you take at home?
Well, the more data that we have about what's happening, not only in the state, but the community level, that really might impact future decision-making as we kind of evolve with how COVID evolves. So home tests are that one way that we can move in that direction of living with COVID, but we really need to try to close the loop and make sure that the Department of Health knows about those results too.
And I understand you want to tell us about, there's a new way to report it actually. I guess was it here or got online recently, a new way to report if you have a test, we've heard why it's important. Where would you report it?
Right, and so there is a website that the Department of Health has. It's called One Stop, and you can make an account. The wording is a little tricky. It talks about, applying, and there's a $0 kind of notation there, but don't let that deter you. Just kind of go through the steps, and that way you can report it. I'm
sorry, can you explain that again? Just a little. They have some dollar amount that you can donate that you don't need to do that.
No. I think just the way that the website worked in the setup, there's like a $0 fee of making a account that I could see would deter people from doing that, but it's just kind of how they could get the website up and running. So don't worry about that and go ahead and go through the process. It's free.
And you go to the Talbot County Health Department site there to register for that, or the Department of Health, you said?
It's Department of Health. I think if you Google Department of Health with Maryland,
sure,
and One Stop, you can find it.
Okay. And then last question for today is that Easton just has received, I guess they're building a new testing site. You want to talk about that real quick and why that's important for people?
Sure. I don't believe they're up and running yet, but it will be another good resource for testing. So that's good. We saw the need for increased testing at Choptank weeks ago, and we expanded our capacity really quickly. And then home tests are also becoming more and more accessible. They are available. You can find them online, and then even there's going to be ways to kind of get them out through different resources. There's a new website that you can go in there and kind of ask for, and then they'll be shipped to you for free. That's going to be live tomorrow, and there'll be more information coming out there too. Okay, great.
Megan, listen, we really want to thank you for your time today, and we look forward to talking to you on Thursday. If you have any other questions, you can email info@Choptank Community Health, and we'll try to summarize and answer your questions as best we can with Megan next time we meet, which will please send your questions in anytime you feel like asking one or you have one. It's a very changing scenario, so we welcome your question. Megan, thank you very much, and we'll talk to you on Thursday.
Thank you.
Thanks.